Most patients just need a simple medical clearance from their primary care doctor. However, knowing that erectile dysfunction is associated with many comorbidities, including heart disease and diabetes, oftentimes we recommend a cardiac clearance from your cardiologist, and sometimes an endocrinology clearance if you have trouble getting your diabetes under control. In the setting of other comorbidities, we may request other clearances, such as ones from your lung doctor or pulmonologist, or in rare cases, a neurology clearance in the event that you have any neurologic issues. With insurances, oftentimes we'll do the legwork for you. We'll call your insurance and confirm that you have coverage. If you're proactive and you want to find out for yourself, you can call your insurance company and ask them if they cover CPT code 54405. Like any procedure that requires anesthesia, we recommend you have someone that can watch over you for 24 hours. You should bring a loved one or a friend or family member that can take you home, as you will not be able to drive after the procedure. Simply taking an Uber or Lyft by yourself is not sufficient. You can bring a loved one with you to take that Uber together. There are services that are available that will pick you up, take you home, and watch over you for that 24-hour period. Look at our website for more information on these services. Prior to your procedure, we'll give you a handful of instructions. I typically schedule a follow-up visit about a week or two prior to your procedure to go over these instructions again. We give you an antibiotic wash that we want you to use like a body wash, but with a little more focus from the waist down, that you use starting 3 days before surgery. We recommend using a vacuum erection device if you have one or can acquire one. And you want to use it so that you can maintain an erection inside the cylinder for at least 10 minutes once a day. We want you to do this for as long as possible, ideally at least 2 months prior to surgery. And the benefit of using a vacuum erection device is it stretches the penis and allows us to maximize your penile stretch length and get a bigger implant in. Recommendations regarding your medications will be provided prior to surgery. If you are on a medication such as Ozempic, you may need to stop that 1 week prior to your surgery. If you're on blood thinners, we will get recommendations from your cardiologist or the doctor managing your blood thinners on how long to stop it before your procedure. If you regularly shave, then we recommend shaving 2 weeks or further out from your surgery. Otherwise, just leave it to us. We will make sure that you're shaven prior to surgery. Shaving just prior to surgery at home can cause nicks that can sometimes lead to infections under the skin and increase your surgical risk. We recommend stopping eating and drinking anything after midnight the night before surgery. There are cases where you may need to stop eating solid foods for a longer period of time, especially if you are on medications that slow down digestion in your gut. On the day of surgery, just bring yourself. We do recommend picking up your medications ahead of time, and typically, we will go ahead and prescribe them as such. The most important thing to bring with you is your caretaker. On the day of surgery, you'll come in, you'll get changed, you'll get an IV, and we'll have you relax and lay down. You and I will have a discussion, and we'll again talk about the procedure you're about to have. You'll again get an opportunity to ask as many questions as you want. And the goal is for you to feel comfortable that day and know that you're in good hands. We'll talk about what's going to happen after surgery. And I'll remind you of some of the things that I want you to do immediately after surgery, knowing that you may forget some things once you've had some anesthesia. Nervousness is common. Having cold feet, again, very common. Just rest assured, you're with a Titan Center of Excellence. I've done hundreds and thousands of this procedure. This is what I do. You're in good hands. In the event there's some complication or we encounter some anatomic anomaly, it's fine. We'll deal with it and you'll still do great. All right. In the event that you have a rare bump in the road, we'll get you through it. All right. That's what we do. So just be sure and rest assured that you're in good hands and you're going to get taken care of. You're going to have a great outcome. And at the end of the day, you're going to be extremely happy with your device. If you have questions before the surgery, we have ample resources for you to reach out to. We have patient educators who can further discuss what their journey was like when they went through the same procedure. And you can always make an appointment with me or call our front desk and let them know that you would like to discuss the penile implant surgery one more time. You can also send questions through the portal. And I intentionally make a follow-up visit just prior to the surgery to, again, rediscuss these questions that you will have.